Hello, everybody. My name is Mike Lawson. I'm the head of experience here at the Diabetes Hands Foundation, and I'm excited to be hosting a live interview with all of you guys today and to introduce Michelle Litchman. Michelle specializes in diabetes care out in Salt Lake City, in the Salt Lake City area, and she's going to explain a little bit more about herself and about some of the research that she's done about the role of the diabetes online community, which I think during this interview she'll probably be preaching to the choir, but it's nice to see some research that confirms some of the stuff that we know really well. So Michelle, go ahead and take it away and give us a quick introduction.
Hi, thanks for having me here. I am excited about this interview. So a little bit about myself. I'm a family nurse practitioner working at a family practice and internal medicine clinic, and they specifically recruited me to help individuals with diabetes. Couple of things about me and my diabetes practice. I have a house call program for older adults who can't get to the clinic, so I actually go to their home, work with home health in managing their diabetes from home without having to have them come to the clinic. Me and a coworker, MJ Tran, we co-host a diabetes mixer once a year. Mike Lawson was actually one of our first guest speaker at that. And it's just a way for individuals with type 1 diabetes to connect on the ground here in Utah. And then I've hosted a Fakebetes challenge, which is where healthcare providers and individuals with diabetes kind of connect together so healthcare providers can have a better experience of what diabetes might look like by actually trying to live with it. So that's a little bit about me. As far as my research goes, finishing up a PhD program at the University of Utah, and what I was specifically interested in, and Mike actually was a little bit behind this, he kind of inspired me to go this direction because he shared his feelings about peer health and what that meant to him. So what I wanted to do was look at the diabetes online community. There's not a whole lot of information out there. Look at, well, who are the users? What can be learned from how often they're engaging the diabetes online community, so whether they're posting or just reading or sharing experiences, providing feedback, those types of things. And what does that mean to their quality of life? What does it mean to their A1C levels, etc.? So because I did a cross-sectional survey, which is essentially just doing a survey gathering data, I can't speculate that there's any causation, but there was definitely some interesting results as it related to the more people were engaged, there was, it actually had a positive effect on their A1C. So I measured 5 levels of engagement, and for every one that you actually engaged with, you had a 33% chance of having an A1C less than 7, which I think is pretty remarkable. It shows the fact that there's some sort of association there, and a little bit research, further research needs to be done, but that was the main finding, which I think is phenomenal.
Totally. And so what you're saying is you can't say for sure that an A1C result is lower because of involvement, or maybe people with lower A1Cs are more involved online. Exactly. Like it could be either of those things, right?
Absolutely. So, but there were other things that had good associations as well. Individuals felt there was an association with empowerment, feeling like their questions about diabetes were being, that they got answers to their questions, they were felt more understood, they felt less alone. And so all of those things kind of tied together. People definitely found it beneficial, although those who responded to my survey could have also thought it was beneficial. So sometimes research is quirky that way in that you can't tease everything out.
Totally. Can you kind of explain how the TuDiabetes community was involved in this research? Because I know that you posted and...
Sure. So initially I actually did a pilot study. So Mike, you were a part of that. There was about 8 people who responded to the pilot survey, trying to just make sure that the questions were as good as they could be, knowing that a lot of the survey questions were standardized questions that couldn't be changed. I got involved with TuDiabetes because I knew of type 2 diabetes. I had contacted Manny about what was going on there. in advance, and felt like it was a good place to start. And so, and I feel like it was a more controlled environment where social media, as you know, can go from one place to another. You can blast things on multiple sites at the same time. And TuDiabetes seemed a little bit more controlled, where if people were a part of it, they had to, I don't know how to explain it, but it was just a more controlled environment. But after a couple of months being on TuDiabetes alone, we expanded it. So then I started trying to recruit people from other places as well.
Cool. So we have a question. It's actually not for you, Michelle, but in the chat room, Emily Coles is asking if anybody in the chat room has seen a reduction in their A1C since joining the online community. And so hopefully we'll get some feedback, just maybe some anecdotal answers. We got a couple of maybes and a couple of I dids, but it'll be interesting to see.
Yeah.
Can you maybe talk really briefly, and maybe you don't have anything to report on, but was there anything that you found in your research that was negative? Did it point to did the online community or involvement in an online community do harm to anybody, or is there anything negative to talk about?
Sure. So I looked at that. I asked specifically about help and harm, and there were a lot more people who felt like they had been helped. Those individuals with type 1 felt like they had been helped. Those with type 1 or LADA had been helped a little bit more than those with type 2. With regards to harm, only 3% of the sample reported harm, and I categorize that as minor, moderate, or major, and everybody reported minor. Unfortunately, I didn't collect further data to see, well, what did they mean by that harm. I think that those individuals who had type 2 diabetes were more likely to report harm. And so I don't know what that really means. We know that just anecdotally that there were more people with type 1 within the online community than with type 2. My sample was 70% type 1 and 11% LADA, and then the rest had type 2. When I also did a qualitative analysis where I interviewed 20 baby boomers, and one of the negative things that came from that was a couple of things. One is some people benefited from being able to vent and try to share their emotions. There were other people who felt that was negative because they didn't want to listen to crybabies. So that was one thing, but I guess it's all a matter of perspective and what you're going there for and what you're trying to get out of it. There was one incident of kind of a bullying incident, and then one other thing that someone found was negative is trying to post acute concerns like a possible DKA, where they thought that was people should have responded back saying, well, go to the hospital, call your doctor, whatever, versus kind of commiserating, I guess is the right word to say. So those were the negative things, but nothing that said that they were psychologically damaged from it or anything like that. Nobody said that their A1C was higher. But again, it's hard because I didn't focus on just being harmed when I initially did the study, so this is just kind of what came out that probably needs further exploration.
One question that I know you asked in your research was about patients talking to their healthcare providers about either information they found online or the support they're receiving online. Could you talk maybe a bit about some of those numbers?
Yeah, so there was actually a pretty low response of individuals who actually told their healthcare provider that they were using the online community. However, those that did were more engaged with the community and had a lower chance of A1C. So it's kind of interesting that the relationship with your healthcare provider and your willingness to kind of talk about and share that information may tie into engagement, your willingness to engage, and then may, in a sense, tie into A1C as well. But that needs to be teased out further.
Yeah. And I think you also talked, it's the same topic a little bit, but about different reasons that people maybe don't feel comfortable telling folks or telling their doctors that they're using online help. Do you remember any of the responses to that? Am I putting you on the spot? Because I'm like remembering things, but I don't know. the exact details.
Right. So I think that some people didn't talk to their healthcare provider because the provider visits are so short and it just didn't come up. I think in some healthcare providers, people are being talked at instead of, asked questions about what they think. So that's potentially one issue. I didn't specifically ask, well, why didn't you tell your healthcare provider about what you're learning online? I didn't specifically ask that question.
Sure.
And I think that, me as a healthcare provider, when I'm with patients, I don't necessarily get to that. I try to be more forward-thinking because I know that some patients are going to be going online, and in many cases, I actually recommend certain sites. But I think that sometimes it doesn't come up because we're focused on not just numbers of diabetes, but we're focused on blood pressure and cholesterol and other things that sometimes it just doesn't come up. And unless I have a reason to bring it up or a patient has a reason to bring up, unfortunately, it doesn't always get brought up.
Sure. I'm looking at the chat. We have a couple of questions, and they both have to do with people living with type 2 diabetes. And the first one's kind of just wondering if you had any theories or guesses about why people living with type 2 reported harm more often. Is there anything you can speculate on?
I can't. But so one of the things that I failed to mention earlier was one of the things that people did mention a couple of times was kind of a battle between type 1 and type 2 that can sometimes go on. And I think that a lot of those discussions are, if there's a moderator, people can kind of try to calm those down, or there's some people who will step in and try to tame the conversation. That's potentially one source of people feeling like they're not included. I don't know. Again, there wasn't as many people with type 2 in my sample, so it's really hard to say what exactly is going on. One of the things that got brought up at my dissertation defense was that with diabetes, we all know that type 2 is the big bear out there, and obviously there needs to be something for any type of diabetes, but to try and reduce costs and different things, that really it's how do we get individuals with type 2 using the online community to see if there's benefit, because right now it doesn't seem like there's as many. And perhaps there's more now than when I did my survey, because I did my survey end of, in 2012. Mm-hmm. So it's been a little while since I got these results posted.
Sure. And so the last question that the last answer you just gave kind of ties into another question that I have, because I know you've worked quite a bit with older adults, and oftentimes we see more instances of type 2 diabetes in the older population. And so I'm kind of curious about how we could engage elderly populations to get online. I know there's a lot of barriers. Could you see any sort of are there any examples of older adults that have done the online stuff really well that you could think of?
It's a great question. I don't personally know of anything. I think that technology could be a barrier. As we all age forward, all of the baby boomers are going to have all that technology, and they're going to be able to access that in a nursing home or wherever they may be. But right now, I think there's some barriers technology-wise. But one thing that would be kind of an interesting experiment is some of the assisted living homes that I go to, they have like We Day, where some of the older folks are playing video games together, and so maybe if it was done in a group format, which would be nice because you get some of that peer-to-peer stuff live anyways. But that would probably be a place to start until people really got engaged with the technology and felt better about it. I mean, how many people do you see in an assisted living home that have their own laptops? There are some, but not as many. So technology is probably the biggest barrier, but it can be overcome one assisted living perhaps at a time.
We also have a question that I wrote earlier. As a healthcare provider that really kind of understands the value of this community, I think you might have an interesting perspective for someone like me. How could I get my medical providers, my doctors, my care team to understand the value of this so that they would hopefully spread it to other patients, or at least be positive about it instead of thinking that I'm on here, you know, absorbing misinformation or bad information?
That's a tough one. So I know that when people share things that have been helpful to them, that me personally, I always try to explore the website, see where they're coming from so that I can get more information. Perhaps we don't all have time to do that. I think that, you know, talking to them initially is going to be a key, and providing examples of why it's been valuable to you, why the peer support is valuable, because there's something to that. And then I think that additional research needs to be done to kind of validate from a healthcare provider perspective of what's going on. Unfortunately, the research does a lot of talking.
Definitely. I have another question from the chat. This is from Miss Emily Coles.
Okay.
Curious if you have any insight on or any ideas on how we might better serve people with type 2 diabetes on TuDiabetes, but also just in the online community in general. We have far more members with type 1, even though, as you know, the world has far more members of people living with type 2.
I think the difference is that, you know, if I have type 2 diabetes, in my workplace, I'm bound to probably find someone, or a neighbor, or someone I go to church with, or someone. I'm better able to find someone who has type 2 diabetes who I can maybe share the experience with in type 1. So maybe there's not as much of a need. I don't know. But one of the things that I think would be valuable in trying to spread the word is actually going where individuals with type 2 diabetes are going. So here in Utah, we do an American Diabetes Association Expo. There's thousands of people with type 2 diabetes that attend that, along with some that with type 1. And so I think that would be a great avenue to actually get to the patients, because filtering down from the healthcare provider down to the patient may not be as successful as quickly.
Cool. I also know that in the past you've done some blogging as a nurse practitioner. You were blogging.
Right.
And it wasn't like you were just a person out there blogging. You were very clear that you were a nurse practitioner when you were doing it, and a lot of the stuff that you talked about was how you work with people with diabetes and about the work that you do. So I am curious, do you feel like our world would be a better place if more healthcare providers were out there doing that? And do you think that they would be able to do it as good as you did it?
Good question. I think that it would be helpful because people would know the community and how important it is to get information that's correct out there online. And I think that it's important for those types of discussions to come up. I talked about in one of my blogs maybe something that's maybe a tad more controversial, which is insulin pumps in an elderly population. I do it all the time for the right patient. And it's definitely something that crosses my mind, where other providers might think of that as an absolute no-no. I think you have to try and weigh things, and I think that sharing information of things that are unique about your practice is important.
Totally. I like that. So in a perfect world, how would the doctors participate in the online community? Would it be doctors prescribing? Maybe people to go out and explore? How do you feel about that?
That's actually kind of my next step for the research that I'm interested in doing. The hardest thing for me, and I actually find value in peer health. You know, just personal side note, my son has multiple allergies, and I've actually ventured blogs in different communities for support for myself and my husband, and ways that we can better take care of our son. And so I personally have seen the value in peer communities for that reason. And I think one of the hardest things about prescribing an online community is the risk of harm. Are you going to send someone to a site where they get misinformation, or we see this more in teen online communities, like online teen bullying. Are we sending them somewhere where they may get bullied, or their opinion doesn't really feel valued, and say they don't feel valued? There's a lot of dynamics that go through, and there's so many places where to start. I don't know if it's a Utah phenomenon, but every patient I've asked has not been on Twitter. So that's not something that I can recommend. I know that the DSMA chat is really great, but it's not something that would necessarily work well in my community, because the people that I engage with, at least, aren't using Twitter, to my knowledge, the ones that I've asked. And so I think it's you almost have to tailor it to the individual. That's patient-centered care. Is, okay, well, what type of social media are you comfortable with? Because we don't want to get into we don't have time to teach someone how to use Facebook or how to use Twitter. So you almost have to find out, well, what are you most comfortable with? If it's just looking at one, sometimes I've recommended just one blog post on one page, and then from there, who knows what happens. But it's really hard to get down to that. Well, how do you prescribe it? Where do you send people? Do you send people to a person? I've done that. I've connected someone with you, in fact, Mike, and I've said, follow this person, and they're people that I know the information that's getting out there because I follow them myself. But it's hard to stay on top of all of that. That's not a good answer, but it's hard to know where to start, to be honest. It's really hard.
It really is, and it's always growing. That's, the hardest part is in the time when this interview is done, there will be, 20 more blog posts to read, and
right.
Half of them will be great, and you don't know about the other half. So I'm kind of curious, when somebody comes, like in a clinical setting, hypothetically, somebody comes to you and there's a really great blog post that might have something to do with a problem they're dealing with on, let's say, Carrie Sparling's blog, and you want to send them there. Is this the type of thing that you have, like, a URL written up? Do you pull it up in the office, or how does that look, hypothetically?
So it's happened. That exact example has happened. So had a patient who was having some site reactions to the Dexcom, and I knew that Carrie Sparling had written up a post, and there was a couple of others that had as well. And so I actually Google searched them, found them based on just some search terms, and then I emailed them to the patient in our patient portal during the visit.
And there's no, like, worry about liability or anything there that you're passing off?
There's always a worry about liability. So when I read a blog, I have to believe in the information enough that I'm willing to share that with another person, a patient that I take care of and I'm responsible for. And there's always that. So I always try to, that's why it's so hard sending someone somewhere, because with the trickle effect, I mean, if you send someone to one place, they're bound to find another place and another and another and another. And so, it's tricky.
Certainly. I'm looking at the chat room. I think I got all of the questions that have been asked. If you guys have more, go ahead and type them in there. What else? What haven't we touched on in the research, Michelle? Is there any other area there that you think would be good to touch on now?
I think that there's a couple of I think things that are important is for researchers who do diabetes care, especially anything online, is to actually involve someone who actually lives in the online, the DOC space, to participate in their research. That's why I had the pilot survey where I got feedback from, I think, 8 people total. 5 were from the DOC, to try and validate that the questions that you're asking are adequate. I think that there's not enough patient involvement in research that we're doing, because and it's not just one patient, because everybody's going to have a different experience. I think that having a couple is going to be really important.
Sure.
Let me ask you this. Maybe I can interview you. What do you think would be the best way for us healthcare providers where's a good place to start?
Well, I think there's some bigger sites with a lot of information. I'm a bit biased. We're broadcasting live on TuDiabetes right now, but there's literally years of conversations archived here on TuDiabetes. So 7 years worth of conversations. You can figure out a lot of trends. You can even see, after somebody starts on a continuous glucose monitor, um, certain things happen. Like you start going through, the phases. It's almost very predictable. So it would be cool if I saw more healthcare providers kind of coming and reading. But there's no way for me to tell if they're not doing that already. They're just not participating, which would make sense. But I think just being here means a lot. I think you doing this research means a lot to us because in early conversations that you and I had, years ago, I explained how valuable this is. But to actually see somebody who has, letters behind their name and to write a paper that has like legit data feels very validating. So that's good.
One of the things that I'm wondering if it would be helpful is if someone compiled the top 4 blogs of the week that would be really pertinent for a healthcare provider to know. And I know that everybody, there's great blogs out there everywhere, but what if the top 4 could scroll across the healthcare providers, or at least blurbs about them? I mean, we get Smart Brief, I do at least, which is like the top 10 stories that are happening for the day, the top research, and what if there was a brief that was specifically driven for healthcare providers, and people could sign up for that? I mean, maybe that's something that needs to happen.
That's interesting. There's some work underway in the Diabetes Hands Foundation offices to do something very similar to that. Not necessarily exactly for the healthcare provider, but maybe it could be tweaked a bit. So I wrote that note down. Miss Emily Coles is asking in the chat room if you have any specific stories about a tough case that has been helped, somebody who's been helped by the DOC specifically. Talking in generals, of course.
I don't know that it was specifically the DOC, but it was media. So I had a patient who said to me, I'm not going to take diabetes serious until someone I know has a complication. And I'm really spacing on the name, but there's a rapper, and he went on, I think it was, I'm spacing on the name. He's a rapper from like the early 90s, I think, that ended up with chronic kidney disease and had a kidney transplant.
Okay.
And there was a 3-minute video clip that I showed her in the office because she knew this rapper, she knew of him. Stop me if you know the name. But she actually took things a little bit more serious from there. And she didn't know him personally, but she knew of his work as a rapper and benefited from that, I think. Some people want to know other people that have gone through it. Some people want to know people that they have some personal connection with.
Mm-hmm.
One of the things I will mention that I've done in my clinic since I've tallied up all of these research results is I've started group visits at my clinic to try and bring that peer connection to my office. And so I think it was October we started a group for type 1, and then just last week we started another group for individuals with type 2. And so they come monthly, and it's really interesting. I'm actually not part of the visit. They meet with a CDE who has type 1 herself, and they get to visit with each other, and then I pull them in for very brief visits, one-on-one, and then they go back to group. And from the feedback we've gotten, it's been very helpful because it's interesting to be able to share that experience with someone else and be validated in some of the experiences that you're having.
Yeah.
I find this frustrating, or I've done this or that, and it's not something that I can always relate to because I don't experience it.
Yeah. It's very similar to what we do, online. The connections we're making here are very similar to that sort of work that you're doing. And I also think with the diabetes mixer, maybe could you explain a little bit about that? Because I feel like that is a big diabetes online community party. It just happens to be, in one building for a couple hours on a Saturday night.
Right. So the diabetes mixer came to be because at one of my practices, I wanted this 19-year-old girl to meet this other 19-year-old girl with type 1. Because I felt like if they could meet, they had such similar stories, and I wanted them to be able to talk about that. But being a healthcare provider, I'm limited in that because of HIPAA. So me and MJ, who you know, we threw this party called the Diabetes Mixer. And we had all sorts of ideas about, we should have CDEs teaching people how to carb count, but we threw all that away and just decided, let's have it be fun. People don't need to be lectured at. And so it's, we always do them on a Monday because a lot of restaurants here are closed on Monday, so we can buy them out for the night. And so we rent out the restaurant. We have different vendors from the pump companies, insulin companies, etc., set up booths, and that's what pays for our food. We invite a guest speaker. Mike, you were one of them. We had Ginger Vieira, we had Chelsea Rice, and we also had Sean Busby. We've done 4. Those were all of the guest speakers that we've had. We fly them out here to kind of tell their story on different topics, and really it's just a mingle. It's a social. There's free food. There's a 20-minute little guest speaker presentation, and people really find value in that because it's not necessarily a lecture. It's not necessarily, there's no healthcare providers except a couple that have participated in putting it together. So I think it's different from what we currently have. I mean, you still can get information like an expo type situation because there's vendors. And we try to invite different types of vendors as well. So we had someone from the airport come and talk specifically about their care program that they have and traveling with diabetes. So we try to get different types of vendors too. But I mean, we have some cool video footage of it. It sounds weird until you actually see the video, and then you can kind of see, oh, that sounds kind of cool.
I loved it. I had a great time, and I love seeing that it's growing over the years as well. Do you think that there's a difference in how much people benefit from in-person support versus online support, or what is the difference between the two?
I don't know the question.
Because you participate in both. You kind of have your foot in both of those buckets.
Right. I don't know. I think it depends on, when you go online, you can have these conversations with people all of the time, and if you meet someone like at a mixer, unless you get their information, you might just see them that one time. So I've had people tell me, oh, I sat with these guys at the table at the last mixer, I'm going to go sit with them again, but they hadn't seen each other for an entire year. And so face-to-face, if you don't connect as regularly as you might do online, there's some differences there.
Totally.
There's one study that talked about something called alloy social capital, and the study was like in meetup.com, where people would kind of engage with people on Meetup, and then once they met online, that relationship grew to be so much stronger. So I think there's something to meeting online initially, and then meeting in person that actually strengthens bonds. I don't know if it goes the other way though, where if you meet someone like at a mixer setting, do you have that same bond when you try to connect online? I have no idea.
That's interesting. I think there needs to be a young person working on their dissertation that can take that one up.
Yeah.
Another great topic, I think we've seen kind of an evolution of, I guess, advocacy. People they find the diabetes online community because they need a lot of help in their own management. Then they slowly become the educated that are helping the newbies, and then from there we even see people start their own blogs or making YouTube videos, or even going further than just one-on-one help. And I don't know, I've read your dissertations or the synopsis, so I don't know that there was any research in this, but maybe somebody could grab this topic. It'd be interesting to see, and I was wondering if you had any insight, if there was any benefit in helping others online as opposed to just getting help from others online.
So
Or,
yeah,
or
actually,
those improved A1Cs that we talked about might have, something to do with that.
I didn't look specifically at help, like if you're helping others, is there something about improved A1Cs or anything like that? But people who were helping others felt like they were more helped by the DOC. Does that make sense?
Yeah.
So it's almost kind of this reciprocal, if I share and give you information and you share and give me information, there's something to that where I'm not just taking information, I'm returning it back and helping others.
Yeah.
There's two things that I think are worth mentioning. One is in the qualitative component where I was doing the interviews, one of the things that kept popping up is kind of the concept of diabetes elders. And so these individuals not only have years behind them chronologically, but also years behind them as far as how many years they've been diagnosed with diabetes. And there's something interesting about that concept because there's almost wisdom in that, where you have, as you're aging, not only chronologically, because there's different phases that we all go through as we get older, but there's something to the aging of your diagnosis having more years behind you. And it was kind of an interesting concept of how people were talking about how they can anticipate, okay, well, because I've seen this person who is so many years old and they've had this diagnosis for so many years, I can anticipate that maybe when I get to that stage, maybe these are the things that I could look at. People talked about getting on Medicare. Well, what does that mean to coverage for supplies and all of those things? So I think it's an interesting thing to think about is not only is it helping me now, but as I age forward into the future, how can me learning from older individuals also play a role?
Interesting.
Yeah.
A question that popped up in the chat is that I'd like to throw by you is they were wondering if you've noticed any differences in attendance of in-person support groups among people with type 2 versus type 1.
I will tell you, I don't know, and I'll tell you that the people who have asked me specifically in my office who wanted some sort of support have always been type 2. So that's kind of an interesting thing. I've never really met very many people with type 1 that say, I wish I knew another person, but maybe it just doesn't get verbalized. Maybe it's because we have the mixer, I don't know.
It's interesting, the sentiment in the chat room by a couple of people living with type 1 is that they've been to a few in-person groups, but every time they go, the room is full of people they don't really relate to. People, who are, just on a different, probably living with type 2 on a different regime, I would imagine. And then we have one other question. Oh, go ahead, Michelle.
Well, I was going to say that's one of the reasons why we've kept the mixer type 1 only, or I kept my initial group visits that I initially started type 1 only, because in my experience, and this is from survey data from the mixer, is that individuals with type 1 who attended our mixer were more likely to attend again if it was kept just type 1. There's something different, although, when we just had our first type 2 group last week, someone asked, well, why is this type 2 only? Why don't we have other people with type 1 here? So it almost seems like maybe someone with type 2 might be more open to the idea of crossing. I don't know.
It's interesting. I have found in the TuDiabetes world, once somebody kind of makes the switch from living with type 2 and not using insulin to living with type 2 and starting to use insulin for diabetes management, the similarities become almost extinct, and the conversations have a lot more similarities than not.
Right. I agree.
So it's interesting. I don't see any other questions in the chat room. Do you have anything else that you want to touch on?
Well, I have a thought that I want to bring up, and maybe this is an interview question for you again. So one of the things that you hear sometimes is the concept of social media burnout. You'll see people go on Facebook and say, I'm done, I'm sick of Facebook, so they stop for a little while, or they'll close their account for a while. And so I'm wondering what happens when, and there's been a couple blogs about DOC burnout too, so what happens if like a big player has DOC burnout? Is there enough structure behind the DOC to keep it propelled forward? And that's just one of the, I don't know.
That's a really good question. I think I work in diabetes, so like my job is at this diabetes nonprofit, and so if someone who blogs, their job, if the high-profile bloggers, their job kind of becomes diabetes blogging. So I could see how it could become very difficult to have this condition you live with all the time become part of your job. So then you're even doing it at work all day. I think though that there's certainly space. I think as far as I can tell, even the bigger bloggers, like we don't look at them like they are a news outlet. We do know they are kind of documenting their lives, and they're going to go on a summer vacation and write nothing for a week and that sort of thing. So I feel like the structure of it isn't too demanding, but that's my perspective. I'm a huge oversharer. I find so much value in taking photos of everything I eat and everything. So my perspective might not be the best one. So, but I've never been in a position where I've gotten angry at somebody or didn't understand if they stepped away for a few days or whatever.
Cool.
My 2 cents.
Yeah, I think that would help from the prescribing perspective, because if you send someone to a site and then they don't post, it kind of defeats the purpose. So, kind of an interesting concept.
Cool. You're a member of TuDiabetes?
Yeah.
So, I mean, everybody can look for her here. Is there anywhere you want to send people, your Twitter or anything?
Probably the Twitter is probably the easiest. It's just at MICHLATCH Mitch Litch.
Cool. Thank you for doing this. I think that, just like I said, the work that you're doing is very validating for people that are kind of living here on TuDiabetes in this space. So thank you for that, and thank you for coming here to share it with all of us.
Yeah, thanks for having me, Mike. See you later.
Bye-bye.